the show, patients up and down the country are facing the worst strike disruption in NHS history. That's after consultants announced they'll walk out straight after junior doctors. They already earn an average of £128,000 a year. Nevertheless, they're demanding a 35% pay rise on top of that. Joining me is Alia Butt, an NHS psychotherapist and part of the NHS Staff Voices group. Good to have you on board, Alia. Tell me what you make of this, because to many, many people, in fact, the vast majority of people watching this programme today or listening to me on the radio, £128,000 a year is the most enormous amount of money, and they won't understand why anybody would want or need to earn any more than that.
I think, the issues that we are seeing in the NHS have been around for a long time now, after years of critical underfunding and, the understaffing that we've been struggling with due to suppressed wages across the board, are making it very, very difficult to work in the NHS. We've had a few strikes recently, and consultants have been covering, keeping people alive during that time. They're a vital part of the NHS workforce. I would say the real question should be why staff are feeling so unable to work at the moment, and why they're finding the situation so difficult, and why the government has allowed a situation where we have so few staff on the wards, where people are burning out at horrendous rates, are leaving the workforce. We're seeing a really difficult time in the NHS, where we have far fewer staff than our peer countries. We've known that anecdotally while working in the NHS for many years. We've been sounding the alarm for a long time.
Sorry to interrupt you and everything, but obviously if you're a junior registrar, or if you're a registrar, even a senior registrar, what you're saying applies. But if you're a consultant, that's a very different kind of life in the hospital, isn't it? That's a kind of one ward round in the morning, possibly another in the evening kind of a life. That's a life where you can do private practice as well, and very many consultants do, and why shouldn't they? If they've got the time and they've got the energy to supplement their income very much further. That's where many consultants have an incredible NHS pension, the kind of pension that most other people in the country can't even dream of. So the consultants who are walking out are not subject to the same rigours and the same exhaustion and the same level of having to cope with understaffed wards as junior doctors, which can mean very senior doctors, but just not consultants. Consultants' lives are not the same, are they?
They work with people who are struggling. We are all struggling in the NHS, and I have to disagree that working in a private practice is the same thing. We need workers in the NHS. We shouldn't really have a situation where people are leaving the NHS to work in private practice.
That's not what I'm saying. I'm not saying that consultants. I'm not saying that. I'm not saying consultants leave the NHS to work in private practice. That's not what I'm saying at all. I'm saying once you're appointed a consultant in the NHS, then if you want to, you don't have to, but if you're motivated so to do, you can set up in private practice. And then if you do, you can, double, quadruple the amount of money you're earning in the NHS. Many NHS consultants, and why shouldn't they, have private practice. What I'm saying is that their NHS basic salary is high, and they can supplement it enormously by working in private practice. And so that's why it's so surprising. Not that junior hospital doctors are striking, but the consultants are striking, because people will think that they are the people at the top of the tree, earning the most, with the most ability and capacity to supplement their earnings dramatically. They won't get why they're striking. And I still don't think you've explained a lot about junior hospital doctors, nothing much about consultants striking.
Well, I think you misunderstood my point, Vanessa. I'm disagreeing with you. I'm saying I think it is a problem that doctors are feeling incentivized to work in private practice and earn much more money. We only have one pool of doctors. We are critically understaffed. They should be working in the NHS, where people are able to get life-saving treatment, free at the point of use. People can't afford to go to private practice. They can't afford doctors being in private practice. They need the doctors to be working in the NHS and to feel as though they can earn a significant wage without having to supplement that wage via private practice.
Well, it's not that they feel that they have to supplement it, is it? It's the fact that they can supplement it. So doctors, if you speak to NHS consultants, they will tell you that they can do a full day in the NHS. They can do their ward rounds. If they're surgeons, they can do their operating. If they're physicians, they can see their patients, they can diagnose them. And then either very early in the morning or at weekends or in the evening, they will then go to their private practice, which they say they've got the energy to do. It's not that they'll starve if they don't do it, but by doing it, they can lead more comfortable lives. Their families can be more affluent. I don't know if there's anything wrong with that, but I think every single one of them will argue they're not depleting the NHS of resources. And I'm talking as somebody who was married to an orthopaedic surgeon who worked in the NHS, but also when he became a consultant, set up private practice. He wouldn't have thought that he was depriving the NHS. He'd had to wait years to get to the part of his career which enabled him to be in a position to set up a private practice. But when he did, he did.
Well, I disagree with you. I think it is a terrible thing when we have doctors starving the NHS of staffing because they're getting more money. I think that is bad. I don't think that's good. We've had the King's Fund report showing that we have over 50% fewer doctors in the NHS than Germany, more than that in France. We are seeing that there aren't enough workers. So when we have one pool of workers leaving to work in privatized communities or in private companies, that's not helpful. We have a real struggle in the NHS. People are leaving. The reason we are seeing people retiring early is because the job is too strenuous. So I guess we're disagreeing, Vanessa, in that respect. I think it's terrible that we don't have workers in the NHS, and they are depriving the NHS by going elsewhere because we don't have the staff. We have very few staff on the wards. We have a huge mortality rate and excess deaths. The King's Fund report has shown that we are struggling in the NHS to provide decent healthcare. As compared to the peer countries, we have a much lower rate of decent healthcare, and it's a real problem. We have below average spending on patients in this country.
Alia,
and it's not
thank you for taking time out of your busy day to talk to us. We appreciate it. Thank you. Good to hear from you this evening.